we've done here is we've used autofluorescence, which is the excitation of the tissues with a monofilter light to help demarcate the surgical margins. Conventionally, what we would do is use white light magnification. What autofluorescence allows us to do is add a new dimension to detect abnormalities which may be histologic or perhaps only genetic, and use those in a real-time way to evaluate surgical margins.
Many of the early changes cannot be easily or readily visualized, especially when surgeons decide the surgical margin in the operating room. We have a new device developed from BC, and we have been using that to observe the oral lesion extension of premalignancy and the cancer. And so when we shine the light to the tissue will automatically generate a color called tissue autofluorescence. It's shining as a green color. So when we shine this blue light to tissue, if it's normal, we'll have a green tissue autofluorescence. So we can observe this green light. And if it's abnormal, it will lose of this green light, so it will show dark. So dark and the green, so easy to distinguish. Then mucosa usually red, redder, pink. It's hard to distinguish to many of the clinicians' eye. With this device, and we can see those clinically not apparent change that we can decide a better margin. It's not to cut a wider area, but it's better area. For those area need to be cut, then we remove, but not, so we don't do overcut or undercut. Head and neck surgeons are willing to adopt this technique in changing their practice, because currently they just use their naked eye to decide a surgical margin, and this has really revolutionized the way how they visualize the lesion and do a better surgical treatment.